Hello, it's Dr. Rhonda Johnson. Today is Friday, April 5th, 2024. And today I'm doing an important update on COVID-19 for immunocompromised people. So I have two important messages today. The first update is regarding the spring dose of the updated 2023-2024 COVID-19 vaccines. The CDC on its website, which was updated March 6, 2024, says that people who are immunocompromised, who received one dose of any updated 23-24 COVID-19 vaccine, that's Pfizer, Moderna, or Novavax, should receive one additional dose of an updated 2023-2024 COVID vaccine at least 2 months after the previous dose. The CDC says to talk to your healthcare provider about getting additional doses of the COVID-19 vaccine. Now, the second update is that the FDA has approved, under the Emergency Use Authorization program, a new pre-exposure prophylaxis medication to protect immunocompromised people against COVID. The medication is expected to be available sometime this month in April. Now, the price hasn't been set yet, but Medicare and private insurance plans are expected to cover it. The medication's name is Pemgarda. That's the brand name, Pemgarda. It's for people who are at least 12 years of age, who weigh at least 88 pounds, and are moderately to severely immunocompromised. Now, experts say that around 3% of Americans, or 7 million people, fall into that moderately to severely immunocompromised group, and includes, and this is not a full list, just a partial list, people who have had solid organ transplants, like kidneys or liver transplants, stem cell transplants, people who are on chemotherapy for cancers such as lymphoma and leukemia, among many others. So check with your healthcare provider if you're not sure if you are severely or moderately immunocompromised. So what is Pemgarda? It's a monoclonal antibody that uses synthetic antibodies made in the lab. They attach to the spike protein of the SARS-CoV-2 virus, and they prevent the virus from entering the body's cells. The clinical trials had around 700 people almost, and the Pemgarda medication reduced the risk of developing symptomatic COVID by 70%. It doesn't take your risk to zero, but 70% risk reduction. Now, the good thing is that these studies were done, the clinical trials, when the JN.1 subvariant was circulating, and the JN.1 is still the predominant coronavirus subvariant here in the United States. Now, Pemgarda has to be given by an IV infusion, so it's intravenous over 1 hour, according to the manufacturer's website, and it says you have to be observed for 2 hours post-infusion to make sure you don't have any bad side effects like anaphylaxis or anything else. Now, just to recap, on the company website, it says it's indicated for pre-exposure prophylaxis of coronavirus disease. The company website clearly states that this is not a treatment for COVID-19. You can't get it if you're infected with COVID. You can't get it if you're not moderately or severely immunocompromised. You can't get it if you've had a known exposure to a recent known exposure to somebody who's infected with COVID. And also, folks, you have to wait about 2 weeks after a COVID-19 vaccine to get the pre-exposure prophylactic drug, Pemgarda. Now, one other thing, it was not tested in pregnant or breastfeeding women. So, folks, I don't know about usage in that population. You will have to consult with your healthcare provider. So that's my update. I hope it's been helpful. I will include the website links for these updates. Be well, take care, be safe, and have a good rest of your day.